Feet problem is very common in people with diabetes. Losing leg, foot or toes are some of the serious complications suffered by people with diabetes. People with diabetes have approximately 23 times higher risk of amputations than people without diabetes. 50% of people with diabetes who have had amputation die within 2 years. In 80% of cases, this is preventable. Diabetes over time can damage both blood vessels and nerves of the legs. Damage to blood vessels results in lower blood supply to the feet. As a result, sore, cuts, and infection of the leg take longer to heal. In some cases, they never heal. Very low blood supply to the foot can result in the death of foot muscle and tissues. This is called gangrene. Nerves of the legs are damaged over time in people with diabetes. This is called neuropathy. The damage to the nerves can usually occur because of poorly controlled diabetes and lack of blood supply. Damage to the nerve can result in either loss of feeling, or burning, or tingling. Due to the loss of feeling, any minor injury is not felt. If these minor injuries are not looked after, it can lead to infection. Nerve damage also over time can lead to deformed foot. This is also known as Charcot's foot. Over time the bones of the feet can also break, resulting in worsening the deformity. There is clear evidence that people with diabetes with better glucose control develop fewer complications, including fewer foot problems. Therefore, one of the best steps to prevent foot problems is to work as much as possible to achieve the best blood glucose control. Risk of developing complications at least doubles if a person with diabetes is a smoker. Smoking will damage blood vessels of the legs, causing circulatory problems. In addition, smoking will damage the nerve of the legs. One of the most important steps which can be taken by a person with diabetes is to stop smoking. One of the best things a person with diabetes can do is to look after their feet. It should include a part of self-care just like brushing teeth. Feet should be examined once a day. Both top and underneath of the feet should be examined in a good light. If there is difficulty in looking at the bottom of the feet, then a mirror can be used. A family member or relative can also help. The feet should be washed daily in water. Mild soap can be used. The temperature of the water should not be more than 37 degrees centigrade. Sometimes people with diabetes are unable to feel high temperatures which can burn the feet. It is very important to dry the legs after washing, especially between the toes. Use simple moisturizing lotion to avoid dry and cracked feet. Do not use the lotion between the toes. Avoid walking barefoot in all circumstances. Any sharp objects like children's toys or small stones brought in from outside by the shoes can lead to minor injuries. Sometimes a person with diabetes does not feel these injuries. As a result, these injuries can get worse and infected. Walking with socks or slippers or sandals is better than walking bare feet. But these do not provide complete protection. Toenails should be trimmed regularly with straight edges. Precaution should be taken not to cut the nails too short. Avoid exposing the feet to the extreme temperature. Feet should not be placed in front of a heater. Avoid hot water bottle or heating pad on your feet. Instead, wear socks if feet are getting cold. It is common to develop hard skins on the feet. These hard skin patches are called corn or callus. Do not cut, use razors or corn plaster, or over-the-counter remedies. If left untreated, these corn or callus can lead to infection. Choosing the right socks and shoes is very important. It is best to choose socks that are soft, lightly padded and without any seam. Always use a clean pair of socks. Shoes should be soft and firm-fitting. Always choose the right size. Before wearing the shoes, always check them for any sharp objects like small pebbles. Your feet should be examined at least once a year by your healthcare professional. Your healthcare professional should include checking the feeling and pulses in your feet. Ask your healthcare team to show you how to care for your feet. Contact your healthcare professional if cut, blister, or bruise on your foot is not healing. You will need to be seen urgently by healthcare professional if there are signs of infection or gangrene, that is, foot being red, warm, or painful, or black and smelly. The content in this video is for information only and is not intended as medical advice. The content does not substitute professional medical advice. Always consult your healthcare professional for the best possible advice about your own situation. Thank you for watching. Please like, share, and subscribe, and click the bell icon to get new video updates.